Minister of Health, Wellness and New Health Investment, the Honorable Dr. Irvin McIntyre, the Minister of Education, Human Resource Planning, Vocational Training and National Excellence, Honorable Octavia Alfred, National Epidemiologist, Dr. Shaluddin Ahmed, Senior Environmental Health Officer, Kalma Louis, media partners, ladies and gentlemen, good evening. It seems like this is routine for us that we meet every Friday evening to bring you updates on the COVID-19 situation here in Dominica. We'll get right into this evening's press briefing with a presentation by Dr. Shaluddin Ahmed.
Thank you, Ms. Harry. Honorable Dr. Irvin McIntyre, Minister of Health, Wellness and New Health Investment. Honorable Mrs. Octavia Alfred, Minister of Education, Human Resource Planning, Vocational Training and National Excellence. Ms. Kalma Louis, Senior Environmental Health Officer, media and listeners. Pleasant evening to everyone. It is my pleasure to be here today updating you all. As you are aware, the number of confirmed cases of COVID-19 is 18. The two new cases are Dominican citizens working on a cruise line who recently repatriated to Dominica. They were part of a larger group who were screened using rapid test kits on the ship prior to arriving in Dominica. And these two individuals were positive on the screening test. On arrival, they were escorted from the ship to the isolation unit as per national protocol. In keeping with the testing strategy for the repatriated cruise line workers, they were swabbed to confirm their COVID-19 status using the PCR method. Upon receiving positive results, these two individuals were transferred to the COVID center at the Dominica, China Friendship Hospital. They are a 31-year-old male and 32-year-old female. They are asymptomatic. Currently, they are doing fine, and their temperature and vital signs are normal. They do not have any underlying medical conditions. So far, the total number of tests completed is 540. Of them, 522 are negative using the PCR method. At this time, the testing cohorts include returnee nationals, healthcare workers, and suspected individuals. Now, I wish to present a brief update on our community-based screening. Community-based screening ended yesterday, and we have completed a total of 618 households, which accounts for 100% response rate. A total of 1,086 household members were screened. The screening method included checking of temperature, administering a questionnaire regarding signs and symptoms in the recent past, and finally testing for the presence of antibodies using rapid test kits. And I'm happy to say that 99% of the participants were non-reactive to the rapid test. Only 2 were reactive to the rapid test, and subsequently they were negative using confirmatory PCR testing. Additionally, we identified a case with a fever, but they were negative also for COVID virus. A final analysis of this study will be submitted to the ministry in due time, and hopefully this will assist in the decision-making process. I take this opportunity to thank the team members, Dr. Drago, Dr. Daya, Dr. Jaffrin, Dr. Masika, Dr. Jajak, Dr. Jacob, Dr. Moses, Mrs. Florestin Lewis, FNP Paul, FNP Julian, FNP Blaze, Ms. Renee Roberts, Mr. Guy, and other team members for their efforts, even though some had to travel through difficult terrain, and they were successful, and in general, Dominican people were very receptive for this service. And finally, as we are slowly relaxing restrictions of movements, I urge you all to continue to wear masks and keep a safe distance of at least 1 meter between yourselves. And I thank you.
Thank you so much, Dr. Ahmed. And of course, I would like to echo his sentiments and thank the entire team for their tireless efforts in the contact tracing that they've done and also in the care and management of all those in the quarantine unit. To reassure the public that protocols are always in place for given situations. So when our fellow Dominicans return home, protocols are taken very seriously. So I know that sometimes there's a lot of concern about the returnees, but I assure you that Dr. Ahmed and his team do have those protocols in place and have things under control, so there is no need for panic in the general public. And when it comes to the enforcement of protocols for the reopening of businesses, especially in the food service industry, the Environmental Health Department leads that charge. And for an update on those protocols, we welcome with us for the first time Senior Environmental Health Officer Kalma Louis.
Thank you, Ms. Ari. Honorable Dr. Irvin McIntyre, Minister of Health, Wellness and New Investment. Honorable Octavia Alfred, Minister of Education, Health, Human Resource Planning, Vocational Training and National Excellence. Dr. Shalamuddin Ahmed, National Epidemiologist, the general listening public, good evening. At the Environmental Health Department, environmental health officers for the 7 health districts continue to conduct daily monitoring of establishments which have been given the authority to operate. For example, the restaurants, snackets, spas, gyms, hair salons, barbershops, and a few public and private businesses that still continue to operate. The purpose for monitoring is to ensure that the guidelines and protocols given by the Ministry of Health are adhered to. Throughout the week, environmental health officers have been visiting the above-mentioned establishment at least twice a day and for a few hours on Saturdays. On visit, the owners were given the guidelines. Officers have observed at hair salons, barbershops, and spas the practice of hand sanitizing upon entering the establishment. Signage were posted informing clients of physical distancing, wearing of masks upon entry. The number of customers serviced at one time has also significantly decreased to allow for social distancing inside the establishment. Added to these guidelines, Environmental Health Department strongly advises owners and operators, especially hair salons, barbershops, gyms, and spas, to sanitize equipment and surfaces after each use of customers. One of the challenges encountered by the department is language barrier at the salons and barbershop. Therefore, the department has translated the guidelines and protocols in Creole and Spanish and will distribute them to the owners within the following week. In food establishments, employees are seen wearing masks while at work. Customers are not allowed to sit, but only pick up and go, while some have established delivery services. At smaller establishments, such as the grocery shops, customers are allowed to enter and are served throughout an open window or table is placed at the entrance and orders are made. At the supermarkets, customers' hands are sanitized upon entering. Social distances is encouraged, while shopping and number of customers entering at one time is also limited. Upon inspection by officers, once the facility meets the required requirements and is in compliance, a copy of an approved certificate will be given by the department. Public and private businesses also monitor to ensure that the guidelines and protocols given by the Ministry of Health are adhered to. However, it has been observed that customers accessing some of the private businesses do not practice social distancing while waiting on the outside. The department is therefore soliciting the support and cooperation of the owners, operators, and management of all workplaces during our visits. In reference to training of food handlers education session, the department is now operating on an appointment system to ensure all food handlers requiring certification become certified. Food handlers who are desirous are required to call the department at 266-3468 or visit the office at 133 Bath Road to register for the sessions. Please note that on visit, all members of the public should wear a mask or facial covering on entering. Environmental health officers are also mandated to do port health, and the environmental health officers at all port of entry continue to monitor and carry out surveillance of incoming passengers. The Maritime Declaration of Health documents of all vessels are received electronically at least 12 to 24 hours in advance prior to arrival, where the health status of the crew and its members are reviewed before entry. The agent will advise the captain, and they should proceed to the port of entry for clearance from port officials. Screening of passengers authorized to enter the country is done to include temperature checks and filing out of the COVID-19 case-based forms. With all this being said, we also want to remind the general public that we are in the hurricane season, and we are all required to plan not only for the upcoming season, but also to take into consideration the COVID-19 pandemic. All householders should ensure that there is adequate supply of water. Begin stocking up all the necessary supplies of dry and canned foods. Also, for the individuals who may have to access emergency shelters, ensure emergency supply kit is equipped with all the necessary items such as medication, hand sanitizers, masks, and gloves. The Environmental Health Department continues to monitor the environment and the activities of the public to safeguard the health of the populace. We appeal to the general public to adhere to all the protocols and guidelines given to the Ministry of Health and Wellness. Thank you very much.
Well, thanks to the Senior Environmental Health Officer, Calma Louis. And as you can well imagine, with such an extensive portfolio, the Environmental Health Department has a lot of work to do. So we continue to plead with the business owners to adhere to the protocols that have been established and, of course, to cooperate with the officers when they visit your establishment. The concern for our students, both here and abroad, continues, and the Ministry of Education, working very closely with the Ministry of Health, continues to assess and establish the best practices to ensure that the educational needs of our students are met, but of course, to ensure their safety as well. And this evening, we have with us to present the Minister of Education, Human Resource Planning, Vocational Training, and National Excellence, Honorable Octavia Alfred.
Thank you, Ms. Harry. Minister of Health, Wellness, and New Health Investment, Honorable Irvin McIntyre. National Epidemiologist, Dr. Hamid. Senior Environmental Health Officer, Ms. Calma Louis. Everyone tuned in, good night. The Ministry of Education, Human Resource Planning, Vocational Training, and National Excellence is very happy to report that the government of Dominica is ready to repatriate our students who expressed their desire to come home. The Ministry of Education, in collaboration with the Ministry of Health, the Ministry of Foreign Affairs, the Ministry of National Security and the Prime Minister's Office have worked tirelessly to bring our students home. The government has secured 2 flights operated by Silver Airlines to take the first group of students in on Tuesday, June 9th, 2020. 1 flight will leave Fort Lauderdale with 50 students. Although the flight has a capacity of 70, regulations require that only 50 can embark on the spot. This flight will arrive in San Juan at 10:30 for refueling. There, another 20 students will embark for Dominica. If all goes well, this group of students will arrive home around midday. On that same day, an additional group of 30 students will embark a second flight, leaving San Juan at 1 p.m. This means that by the grace of God, 100 of our precious students will be home. Logistics for these 2 flights are in motion. Arrangements with airlines are complete. List of students and other necessary information have been submitted to relevant authorities. Students have been informed. Information which was not available to students last night became available as of this morning. These students will be expected to follow the protocols which are in place for arrival in Dominica. They will require to wear a mask and exercise hand hygiene and respiratory etiquette. They will be required to complete screening to include a COVID-19 test and assessment by medical health authorities. They will serve a 14-day quarantine in the government facility, at which they will be responsible for their essential hygiene and personal supplies during the quarantine period. For example, their toothpaste, toothbrushes, etc. They will be expected to adhere to the additional quarantine guidelines as advised by the health authorities. Groups of students from Canada, Barbados, Trinidad, China, the United Kingdom, and other countries will be facilitated by the 24th of June. This is so because the quarantine period for the first group of students will end on June 23rd, and adequate time is required for the facility to be thoroughly cleaned and prepared for the other group of students. Some of our students are on their final year of studies and will not be required to return. However, the Ministry of Education advised that students will be responsible for their return travel to their respective place of study for the new academic year. Our only challenge at this point is that some students who had previously indicated that they did not want to come home, and students who did not fill in the fact-finding form provided online by the Ministry of Education, are now expressing interest in coming home. We will take the data of these students and try our best to facilitate them as soon as we possibly can. However, we must deal with the students who have been inquiring and waiting to return home first. The Ministry of Education sincerely thanks all those who have collaborated in this effort to ensure our students are brought home safely in these challenging times. We pray that our students will have a safe journey home, and we look forward to welcoming them and offering them the best care available here. It is truly wonderful what the Lord has done. Though the present times are challenging, together we will overcome. Together we will conquer. Together we will win. Together we will. God bless you. God bless Dominica. Good night.
Thank you, Honorable Octavia Alfred, the Minister of Education, Human Resource Planning, Vocational Training, and National Excellence. And as she said, within the next week, 100 of our students will be home, and some more later on this month. Of course, we continue to ask the public for your patience We do not take for granted the anxiety that is being experienced by our students. However, the process of bringing our fellow Dominicans home is not as easy as some may think. The Ministry of Education and, of course, the Ministry of Health are always available to answer any questions that you may have. And finally, this evening, our next presenter is the Honorable Minister of Health, Wellness and New Health Investment, Dr. Irvin McIntyre.
Let me recognize the Minister of Education, Human Resource Planning, Vocational Training and National Excellence, Honorable Octavia Alfred, National Epidemiologist, Dr. Shalauddin Ahmed, Senior Environmental Health Officer, Kalmer Louis. I am pleased to be here again for yet another press briefing. It's always a pleasure to be part of the team educating and updating you, the public. As Dr. Ahmed informed earlier, we have at present 2 active cases. On the 22nd of May, we received 37 cruise ship workers from Royal Caribbean Cruise Line, 4 of whom tested positive for COVID-19 using rapid antibody test. This information was relayed to the Environmental Health Department of the Ministry of Health through the Maritime Declaration of Health. This comes in 24 hours prior to their arrival. The 33 cruise line workers who tested negative were allowed to disembark and placed in quarantine at the government quarantine facility at Portsmouth. PCR testing was done for these 4 cruise ship workers who were tested positive by rapid testing. They were later allowed to disembark in the evening after their PCR test results came back negative. However, in spite of their PCR tests being negative, the mere fact that their rapid tests were positive, they were kept in a special isolation unit at the Dominica China Friendship Hospital. Further testing, that's their second test, of these 4 cruise ship workers revealed 2 positive PCR tests. These are the 2 active cases presently at our COVID isolation unit at the Dominica China Friendship Hospital. In keeping with our policy of bringing home Dominicans stuck overseas, we will again be receiving 19 cruise ship workers on Monday, 8th June. And as the Minister for Education, Honorable Alfred, indicated, more of our students will also be returning home next week as well. We in the Ministry of Health will continue to make the 14-day quarantine period comfortable and safe, as we have been doing over the past few months. In view of our present situation, where we have no evidence of community spread, it is being considered to further relax the restrictive measures regarding the curfew hours, and also allowing the remaining businesses which are presently not open to do so. That's to include tour operators, staycations, cinemas, bars, Lotto Blast, and gyms, as well as the returning of public officers to their normal pre-COVID stations and arrangements. Details of these changes will be made available to the public during this coming week. But at present, all curfew timings and business hours remains as is. The returning home of our fellow Dominicans and increasing relaxation of our restrictive measures should not result in us letting down our guard and losing focus. The public health and social measures, such as washing of hands, proper wearing of masks, and physical distancing, must remain in practice. This new normal way of life calls for a change in mindset from all of us, particularly the youth, since you, more likely than not, will in the future face other health emergencies of concern. Our challenge remains the opening of our borders, but that is the challenge for every country. Opening the borders does present the risk of importing cases, which we are fully aware of, particularly if it's done too early. And as I've mentioned before, this cannot be done in isolation, but should be done with the wider region in mind. We must also be pragmatic in our approach so as to achieve the safest and most appropriate option for our country. We'll also learn from those who have opened their borders earlier than the science suggests. We must face this pandemic with optimism and see the opportunity to become personally responsible for our health and that of our communities. The Ministry of Health, and by extension the government of Dominica, has been taking all measures possible to control this COVID-19 pandemic and will continue in spite of the tremendous cost to the country financially. Let me again convey our deepest gratitude to all the businesses and individuals who have assisted us in one way or the other. Also, international donors to include WHO and PAHO for technical support and supplies. To all our frontline workers, we salute you for your dedication and sacrifice. And a very special thanks goes out to the district teams from the primary healthcare department who have conducted our community testing in very uncomfortable weather. All these measures are part of our COVID-19 pandemic response, which make Dominica the safer place to be. I thank you for listening. May God bless us all. May God bless Dominica.
Thank you to the Honorable Minister. We continue to applaud your leadership in this fight against COVID-19. Again, to the listening and viewing public, no changes as of right now to the curfew order. We continue to urge you, please, to await word from the officials about any changes. And we ask you to continue to trust in the experts who have been doing a superb job of keeping us safe thus far. As always, we like to thank our media partners for enabling us to broadcast this press briefing. We thank you for your cooperation. We thank you to the listening and viewing public for joining us this evening, and we wish everyone a safe weekend.